Thank you for inviting me to Apnea TV. It's a wonderful resource you have put together, and I truly enjoy watching it. But I'm glad to be a participant in this, and it's my honor to be here. I am Ritwick Agrawal. I am a doctor here at Houston. My specialty is pulmonary and critical care, and also sleep medicine. And today I'll be wearing my sleep medicine hat to talk about it. Dr. Radhakrishnan is a very good friend of mine, and we have decided to do this interview during this very interesting period where we have this pandemic going on, and then sleep issues are really acting up for all of us. So I'm happy to be here. Thank you for inviting me. So sleep medicine is a very interesting specialty. It's a very new specialty. We didn't have this field of medicine, say 20, 30 years ago. It's a very novel thing which started more or less in California area at Stanford. There were some specialists who said sleep medicine is equally important and we should study it seriously and make it as a field of medicine. And if you think about it, we sleep about 1/3 of our life. On an average, we sleep 8 hours out of 24 hours. So 1/3 of our life we spend sleeping. So it is really important that we start looking at it more seriously. So that's the sleep medicine field. We talk about how to make normal sleep, how to define a normal sleep, and try to understand why we dream, why we have normal sleep behaviors. And then we treat abnormal sleep conditions. For example, if somebody has, for example, sleep apnea or parasomnia, there are a lot of conditions, problem with sleeping or insomnia, we treat those problems. So that's my specialization. I see clinical patients as well as research in this field. So if you think about problem with sleep, I would say almost everybody has sleep. And that's why if you think about the phrase which came, I slept like a baby. And that's the aspiration everybody has, is I wish I can sleep like a baby. You know, when we are born, nature wants us to sleep long. Babies can sleep up to 16 to 18 hours a day. And as we grow older, the requirement for sleep goes down. And on top of it, the sleep sometimes get worse. So people will have trouble falling asleep, staying asleep. Spouses complain that their spouse snore. People start sleepwalking or sleep talking, or sometimes do all other crazy things. And so the problems start. And then they come to a sleep specialist. And that's what I'm here for. So that is a question very near and dear to my heart. Snoring is something which I do research, and it leads to a bigger problem called a sleep apnea. And what sleep apnea is it's a problem of breathing while we sleep. So, you know, when we breathe in and out normally, nobody snores when we are awake. We are just awake. We have air goes through our nose to the lungs, and we are able to get all the good air. But suppose when we are sleeping, the throat collapses. So there is some obstruction from air going from the nose to the lungs. And it's like a noisy tube. Suppose you have a tube which is just partly obstructed, it will start making a lot of noise. And that's exactly what happens. Snoring is a kind of noise. So snoring can happen because nose can be obstructed. That's the simplest way. Somebody has allergies, somebody has problem with nasal congestion. So, you know, one of my patients had an injury playing football, broke the nasal bone, and then they cannot breathe properly. And those are relatively easy to fix. But if you go one step behind, that's the throat area, the back of the throat. So I ask you to do a simple experiment. I ask you to look at your friends, your family, your kids' throat. And if you can see all the way in the back of the throat, a wall in the back of the throat, that means the throat is wide open. But if you cannot see everything in the back, you can only see a big tongue or maybe top of the throat, that means you cannot see the back of the throat. That means the throat is very crowded. And when we sleep, the throat really collapses down. And then this tube, which is normally wide and open, becomes very narrow. And whenever there is narrowing, it causes snoring. That brings us to a bigger question. Is the snoring really a bad problem? Or is it just an annoyance, you know? And I think it's much more than a simple annoyance. We have evidence that patients who have snoring or sleep apnea sometimes can get really sick. They start developing high blood pressure. I had a patient who had severe sleep apnea. He developed a heart attack. Not only one attack, 3 attacks. And then their doctors found out that when he was sleeping, the throat was collapsing, his body is not getting enough oxygen, and that was causing heart attacks. Blood pressure, I have patients who are on 3 blood pressure medications, 4 blood pressure medications, and part of the problem was sleep apnea because in the night they were really fighting it off. And then in some cases it can cause really severe problems. It can cause strokes. It can cause even sudden cardiac death. So people can die, and sometimes we say this person died peacefully in sleep, and that may be related to sleep apnea. They just didn't get enough oxygen in the night, and they may pass away. So it is actually a very serious condition, and we call it as sleep apnea. And people are slowly getting aware about it. So if you hear somebody snoring, don't ignore it. Try to work it out. Try to figure out what it is. Well, so there are not a lot of treatment. So I wish there was one tablet I can give you. You take it every day, like blood pressure, and this problem goes away. But the problem is bigger. The throat is getting collapsing. It's just jamming on us in the middle of night. So the treatment is if somebody is closing, you blow air and keep it open. So how do we do that? We buy a CPAP machine, which is a small box. It is like a air pressure, blows air through a tube, and we put a mask on the face, and then we sleep. And when we sleep and the throat is about to collapse, it blows air and keeps it open, and that's the most important thing. If the throat stays open, we get good oxygen, we get all the good benefits. So it's a little bit of hassle. I wouldn't say it's easy. But once people start liking it, they do it every day. So it's called CPAP machine, most common treatment. There are some dental devices which can be used, and dentists can do help you with that. There are specialized dentists who know how to make it so that crowding in the throat is better. You just wear an oral appliance and sleep. And now there are several good surgeries available where people can go get the surgery done. There's a special pacemaker now available which can put on the chest, and there are these options which we are looking at. Right, and that's true. Sleep apnea is a problem of affluent society in many ways, but not always. So in other words, if somebody is overweight or obese, it's possible that they will have sleep apnea. But that doesn't mean that anybody who has sleep apnea has to be overweight. I would say a lot of my patients are overweight, but not everybody. When we grow older, the back of the throat muscles become weaker and it collapses easily. So age is another factor. Hereditary, there are some facial structure in which the jaw sort of goes inside. We call it retrognathia. So that's how the jaw is made or the face is made. So sometimes that causes. I have patients who are really skinny, 80, 90 pounds, about 40, 50 kilos, and they still have very severe sleep apnea, just the way how their body is made. So I would say obesity is a big factor, but not the whole picture depends on it. I would say it's a loaded question, Dr. Radhakrishnan. Snoring is equally common in men and women. It is a little more common in middle-aged men, but in women, it's fairly commonly seen. I would say if I have to think about my patients, I would say about 60% are men, but 40% are women. So you may say women complain more and men do not complain as much, but I think it's more of a saying, you know, in my clinic, the spouses come, the husband comes and say, my wife snores like a train. Or wives come and tell, I have to kick my husband every day, every night, so that I can sleep peacefully. So it's both way around. Believe it or not, there is a very new research which just came out a few months back in a very reputed journal. And what they found is it's the tongue. It's the tongue, which is sometimes also called in our medical language genioglossus muscle. What happens is the fat deposition, when the fat gets deposited in the tongue, that is the biggest factor which can cause to sleep apnea. So it doesn't matter if a person is obese or not. If the volume of tongue is high, patients actually develop sleep apnea. So if we can develop some way that we can do dieting and selectively reduce the fat in the tongue, we can fix the problem. Or we can do some sort of surgery or inject something in the tongue. That is something which people are looking at. Nothing is out at this point of time, but this is something which is pretty exciting, and I'm optimistic by the time I retire, maybe even before, we will have something we can just see a patient, do that procedure or do that exercise or dieting or whatever, and get this out of the way. And that would be a great day. Yeah, and nowadays it's getting a big problem too, and part of it is the obesity. You know, now, I do not see pediatrics patients myself, but I was talking to another sleep specialist, and she told me that one of her patients was only 10 years old, but the weight was close to 220 pounds, which is around 100 kilograms. So, you know, unfortunately, the obesity is impacting younger and younger patients. On top of it, the younger patients have these problems with, which can crowd the throat, like tonsils and adenoids. And if we fix those problems, those things get better fairly quickly. But in kids, it's a big problem, because then if a child has sleep apnea, it can impact the day-to-day worsening. They are more irritable, their memory is not that great, they do not perform very well in the school. So it's a big problem, and it's relatively easy to fix if it's related to adenoid or tonsils. We send them to surgery, and that fixes the problem. I think there is some truth behind it. So what happens is, if somebody is drinking alcohol, or especially late in the night, and alcohol is kind of like a sleeping agent, if you may. It works on brain receptors which can make a person fall asleep. It also relaxes the muscle of the back of the throat. So not only a person falls asleep, they also have relaxed throat. And so these patients, if they have mild sleep apnea, all of a sudden they go into severe sleep apnea category that night. So they snore heavier and louder. So it's not really totally out of a fiction. There's some reality behind it. Well, there are a lot of tips, to be honest. We have to respect sleep. We have to respect our body pretty much every way, so that we get 8 hours of sleep, 7-8 hours of sleep for adults. Why do I say so? Sleep is when we recharge. People are really good plugging their cell phone in the charger and giving a whole night, so that in the morning they have a full charge of cell phone. But they don't realize that in the night, when they are using the cell phone too much or waking up too many times or watching TV, that's just a bad sleep hygiene. And if you do not get recharge very well, it causes problem next day. So we are irritable, we are not focusing very well, our quality of work goes down, our productivity goes down, our relationship gets worse, you know. So there are a lot of problems. So these are the tips I can tell you. Very simple. Number one, respect your body. If you want to stay healthy in terms of sleep, spend at least 7 to 8 hours of sleep. Those people who say, I can sleep for 6 hours and I'm good to go, usually they have some problem which they don't realize. So give yourself 7 to 8 hours of sleep. Next thing, we are evolved from apes and our body likes very specific routine. So if you like to go to bed at 10 p.m. or 9 p.m., whatever time you like, every day go at that time. Don't go too early or too late. And for example, it's very common, people go to bed relatively late or the weekend. They do party, they watch TV and so forth. But on the weekday, they have to go to work, so they go on time. And that is really harsh on the body. Our body has an internal clock, which really gets upset if you're not following it. What else we can do? Well, no electronics in your bed. So I tell my patients, leave the cell phone outside your bedroom, charge it somewhere else. No TV in your bedroom. TV has this blue light of the spectrum. And if we have TV on, if we watch it very close to our bedtime, it activates a specific part of the brain called as pineal gland. And that is really, really important because now our body is perceiving it's the daytime and it wakes a person up. So the blue light is perhaps the most, and especially all these digital televisions, those are the problem. What else we can do? We should not drink alcohol at all. I say alcohol, tobacco is not good, or any drugs like marijuana or cocaine. But especially at night, do not do that because it really messes with the quality of sleep. You know, we go in several stages of sleep, and if the stages are not good, we do a bad job. And finally, well, there are several, but the last one I would say is don't exercise too close to the bed. We should tire our body, so you should definitely exercise at least 30 minutes every day so that our body is tired. We have enough pressure of sleep at the night. But do not go to gym at 10 p.m. and then try to go to sleep at 11 o'clock. Our body will just go in a separate mode. So at least give 2 to 3 hours. Same thing about eating. Do not eat close to the bedtime. So those are some of the tips I can give you about sleep. But those are healthy sleep, we have to respect it. Our bed is our sanctuary. Do not do anything apart from sleeping in the bed. All right, it's a pleasure to be here. Thank you for inviting me.